Hi, everybody. It's Elle. We are outside in fabulous Las Vegas with a wonderful spring day. But like any Las Vegas spring day, there has to be wind. So ignore the wind. All right. Why are we outside? Well, mamas, it's because we're talking about pain management. If you're a healthcare practitioner, check out my other video. All right, moms. So let's dive in. Obviously, we're all aware of the opioid epidemic. It is a major problem, and there has been a major approach to try and solve that problem. One of those ways is to have non pharmacological interventions that reduce pain. Obviously, right after you have a baby, it could be warranted to have pain management strategies that do include prescription medications. But physicians are giving a lot fewer prescription medications for pain management. And so we really need to have some good approaches that can help prevent pain. So, occupational therapists, along with physical therapists, we both do pain management strategies and we all have our own little therapy flavor. But today we're going to be getting the occupational therapy flavor. All right, so the first one, exercise. Obviously, if you are a mom who just gave birth, should not be exercising until you've been cleared to do so. Now, going for walks outside or just around somewhere where it's not super populated, so you're not sharing icky stickies, is something that you can definitely do. Another thing that you can do is range of motion. So, something like moving your arm in a circle, right? Or your head. Do you remember your grandpa, maybe, or even your dad, when he would do something like work outside? He would do his head rotations around and around. Okay, those are all range of motion, and they can really help loosen you up. And that's a major issue if you're having pain, because when we have pain, our muscles tighten around that area, and that can lead to muscle knots and a lot of discomfort. So, range of motion, try it out. Muscle conditioning, acupuncture or pressure. So, acupuncture or pressure, this one I want to talk about really quickly. So, acupuncture or pressure is different than dry needling. Occupational therapists and physical therapists can do dry needling. It depends on the state, though, so make sure you check out the requirements of your state. It also depends on the training because dry needling isn't something that practitioners generally get in general school settings, so they have to do continuing education for that. But as far as talking about acupuncture or acupressure, they are completely different. There is this whole theory about the meridians in your body and how pain goes from one area to another. And so if you do acupuncture on this side, then it might impact something over on this side. And it may not be the most researched, but there are a lot of people who have good experience with acupuncture pressure, and there is some research that indicates that it may work. So if you're interested, there are so many resources online that you can try right now. Hydrotherapy, so water, right? Water is something that can definitely help you. Unfortunately, if you are a mom that just gave birth, you should not be taking a bath until you've been cleared by your physician to do so. But you can definitely take showers in nice warm water. Okay. Massage. Massage is something that you can definitely enjoy right after giving birth. It can be light massage, it can be something that is more body work centered. It really just depends on your preference. This is something that you could go to a massage therapist or have a massage therapist come to your home, or it's just something that you could ask your partner or loved ones to do for you. They're all wanting to help and be around baby. Okay, well, join in on the massage. All right, the next thing, mobilization and manipulation. These are things really that should be done by a healthcare practitioner. But definitely a lot of people get pain relief by going to a chiropractor. So if that's something you're interested in, I would recommend it. I know there are a lot of patients of mine who say that they have had great success. So give it a try if you're curious. Some other things that are exercise based that you really should have some clearance to do if you're going to do full on Tai Chi, Qigong, or yoga. But if you're going to do something that's like chair based, something very gentle, you could definitely do that. And there are some of these activities that are available on YouTube channels. So you can just really Google Tai Chi yoga. Make sure that you add the chair, so chair tai chi, chair yoga, etc. And those are all things that you could do as long as it's in a chair and it's gentle. But if you want to do anything more than that, you really do need your doctor's okay. All right, so occupations in the sun. What are occupations? They are meaningful activities. So some people find meaningful activities just hanging out with the kids. Some people find it gardening, all sorts of things, whatever you enjoy to do. See if you can't do that outside because we know that the sun does reduce your perception of pain. So just being out the sun can make you feel better. If you're in the hospital still, open a window, let that light in because that is going to make you feel better. This is also why gardening or going for walks can be so beneficial is you are out in the sun, but there's also this other element that when you do exercise, you do release certain hormones that help your body battle feelings of pain. So just gentle walking, gentle gardening, make sure that you're not doing anything too rough for your body. But those are all things that have been shown to help with pain. All right, so OT intervention strategies. If you wanted to go into an OT, they could help you with any of those things that we just talked about, but they could also help you with the things on this page. So physical agent modalities. In the therapy world, we call them PAMs, and PAMs include things like thermotherapy, cryotherapy, TENS, which is like an NMES, which you might hear called e-stim, right? Those both can help with pain. Ultrasound. So this isn't like the ultrasound where you found out your baby's gender or their sex, okay? So ultrasound used in therapy helps with pain management, and that's something that a physical therapist or an occupational therapist could help you with. All right, so on to cognitive behavioral therapy. This is something that a psychotherapist or an occupational therapist could help you with. So a lot of this is having distraction strategies. So for you, you love music. It could be listening to music, reading a book. Maybe you enjoy meditating. Meditating is so wonderful on so many different levels, even beyond just distracting you. It's shown to help, reduce blood pressure and breathing patterns and all sorts of wonderful things. So give that a try. Meditation is definitely a practice we should all have. Playing games. This is something OTs love to do, right? Whether it's board games or video games, whatever it is, something to distract you from the pain. Relaxation techniques, so deep breathing. Breathing in through the nose. So I like to breathe in for 4 counts. So 1, 2, 3, 4 through the nose, and then out through the mouth. I like to breathe out for 6 counts. So I go 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and I do that for about a minute. And after you do that for even just a minute, you can feel your muscles start to relax. You can feel yourself starting to think more clearly, and you can feel the pain roll off your shoulders. Biofeedback is something that I like to do along with these relaxation techniques, especially those breathing techniques. If you put a blood pressure cuff on your arm before you do the breathing techniques, so you're going to be feeling pain, right? Assuming you're feeling pain, your blood pressure is going to be pretty high. But once you take that blood pressure cuff off and you do some deep breathing, do that for anywhere from a couple of minutes. And then after 10 minutes, I will put the blood pressure cuff back on and we'll check the blood pressure, and it's always lower. All right, hypnosis. So this is something that you can have continuing education for, or there are also different apps that you can get on your phone that can provide you some hypnosis. Imagery and visualization. So some of you might have during your birth tried visualization. So some people during their birthing process like to picture things like waves crashing and that your contractions are matching those waves and that they're coming and then they're releasing and they're coming and they're releasing. And then they try to go into feeling calm, like you're at the ocean, you're enjoying your day. All of those things have been shown to help. So try that out. And this is something that your occupational therapist can work with you on as well. Progressive muscle relaxation oftentimes goes along with mindfulness, relaxation techniques like deep breathing. Okay, and what this is you're doing a body scan, right? You're looking at your body. You're trying to feel all of your muscles. Are your shoulders up to your ears? Is your belly tight? Do you feel your jaw clenching? All of those are signs that you are feeling stressed and or you are in pain. So if we can go ahead and start from the head and go down to the toes, we can tense certain muscle groups, hold it, maybe 10 seconds, and then release it. So something you might do is like your shoulders, raise them up to your ears. 2, 3, 4, 5, 6, 7, 8, 9, 10, and then release them. Okay, and really focus on releasing. Breathing in through the nose, out through the mouth. Okay, if you do this all along your body, you can find some real relaxation techniques. This is something some people like to do right before bedtime. And then mindfulness based, right? So this is the idea that we're going to be cognizant of what we're feeling and what we're thinking, right? And a lot of times we go about our day and we're holding so much stress and so much pain and so much other feelings and emotions that we don't even realize it. And our brain is just irritated and agitated and we can't figure out why. Well, maybe if you check in with your body, so that requires some calm, it requires some quiet, and sometimes a calm room, maybe you want the lights turned down, maybe you want natural sunlight on, and really kind of focus in on what are you experiencing. A lot of people will meditate, and that kind of helps them get in tune with their body because in our modern world, we just really don't listen to our bodies. There's just too much noise. All right, some other things that OTs do include the following. So, in animal assisted therapy, not all therapists do this. So, make sure that if this is something you want, this is something your therapist does. Muscle energy technique, Reiki or energy therapy. A lot of these are kind of alternative types of treatments. So, if other things have not been helpful, or if you want to try things on your own, these are things you can add on. Aromatherapy and essential oils. For me, I'm a big smell person. So if something smells unpleasant, I am going to feel unpleasant because that is something that I'm sensory sensitive to. Okay. So it's all about knowing your own sensory profile and what you're comfortable with and what you're not. And some things that other people might enjoy, like maybe I enjoy scents. I really do. I like calming scents. I like to smell different things. Other people might be irritated by that sense of smell. So it's all about knowing your own sensory profile, what you enjoy, and what stresses you out. Music therapy. So there are certain classical music, what do they call that? Not concertos. There's classical music that is shown to help, right? It helps reduce stress, it increases pain tolerance, and it can calm you. Psychoeducation. That's what you're doing right now. You're learning about pain, right? You can also learn more about, stresses in your life. Bringing home a baby causes a lot of stress, a lot of family changes. So, getting some education on what you can do to help that. All right. And magnets, Pilates, again, exercise, make sure you're cleared first. Psychotherapy. So, that's something you can go to a psychotherapist for, or an occupational therapist who is trained in it can help you. Mirror therapy, reflexology, art therapy. Okay, there's vagal nerve stimulation, hyperbaric oxygen treatment. There's all sorts of fun things, but these get to be more specialized. So make sure that you're going to a therapist who has these trainings under their belt. All right, so I would highly recommend that you all start a progressive muscle relaxation and distraction regiment if you are feeling pain, that your pain management strategies are not helping yet or not helping entirely. So, if you're taking medication that's not helping, or if you are no longer taking medicine, but you're doing some of these other things, like let's say that you're going out for walks in the sun and that's just not doing enough, you can try progressive muscle relaxation and distraction. And that's somewhere that I would start. All right, you guys, I'm going to go ahead and stop there. I hope that you learned something new and this gave you some ideas on how to manage your pain. Talk to you next time. Bye.